Thank you so much for taking the time to be here. If you don't mind, can you start off with just stating your name and your job title?
I am Brigadier General Jeannine Ryder. I am the 59th Medical Wing Commander, Wilford Hall Ambulatory Surgery Center for many, the San Antonio Market Director, as well as the Chief Nurse of the Air Force.
Hi, my name is Brigadier General Deydre Teyhen. I am the Commanding General of Brooke Army Medical Center. I'm the Deputy Director of the San Antonio Market and the 20th Chief of the U.S. Army Medical Specialist Corps.
Thank you so much. Look forward to asking you some questions.
Thank you.
Thank you. The San Antonio Market is a complex, what I would consider is the premier training platform in the Defense Health Agency. We are fortunate to have 11,000 professional medics who take care of 250,000 beneficiaries. There is the Brooke Army Medical Center, there's the Wilford Hall Ambulatory Surgery Center, there is 10 standalone MTFs or clinics, as well as over 100 specialties that are provided. And so we have the Level 1 Trauma Center, the only one in the DoD, Burn Center, biggest inpatient and outpatient. And so it is a vast mission set, making sure we have ready medics and ready forces. And it's just an amazing place to work every single day.
For our patients, what's great about the San Antonio Market is that we actually can take all the resources across military medicine that's here in San Antonio and synchronize them and integrate them in a way that we can provide better access to care to all those folks that want to have care, whether it's at Brooke Army Medical Center, Wilford Hall, or the 10 outlying clinics. By being one market, it's really allowing us to share resources in a way that will benefit you.
Well, I would say the San Antonio Market, when you talk about a ready medical force, is the premier training platform for the entire DoD. When you talk about our capacity from the Level 1 Trauma Center, the Burn Center, the largest DoD for inpatient and outpatient, our medics, both officers and enlisted, have an entire continuum of experience, patient sets and reps that they would not only see in a civilian practice, but also that they are prepared to go into the deployed location.
We are also the largest platform for people to get their initial training and their advanced residency and fellowship training. So when you combine on the officer side our residencies and fellowships for both graduate medical education and graduate allied health education, we have 57 programs that cover the continuum to ensure that those folks get the best education and training possible, because we also have the highest acuity care across the Department of Defense with that Level 1 Trauma Center and all the ICUs and surgical suites to support that mission.
The San Antonio Market, how do we improve, enhance, really optimize and maximize patient services and patient outcomes? And so we are very fortunate the amount of expertise and professionals and innovative individuals who are trying to make sure that we have the right care at the right place. One of the things that we are working very hard is, we call it our surgical optimization. How do we make sure that the right surgery is the right place? We have Brooke Army Medical Center, who has very complex OR capability, and we have the Wilford Hall Ambulatory Surgery Center, which is shorter cases and making sure the right skill sets. And so we have worked very hard to optimize at both locations so that we can decrease our backlog and make sure that people can get the services and the surgeries that they need in a quicker manner. And it has been a true team effort for all individuals.
We're also working really hard to improve access to care for all of our patients in this region. And so what we're trying to do is make sure that from primary care to radiology to laboratory to pharmacy, that we have the right staff in the right location based on the volume needed so we can best meet the needs of those that trust us with their health care.
Our residents go out to other hospitals within San Antonio. We have enlisted who do their phase 2 on other sites. And so I will tell you that San Antonio is invested in our military and our medics as much as we are invested in our medics.
And the San Antonio market is fully integrated into the regional trauma system. So as Brooke Army Medical Center is one of the 2 level 1 trauma centers in the San Antonio area, we actually take care of the 22 counties that surround Bexar County, and that has a large catchment area of where the traumas come in. So for the last 25 years, we've been partnering very well with our civilian partners to make sure that we can take care of the most severe traumas that happen in the area.
The San Antonio market became officially under the oversight of Defense Health Agency in July of 2021. However, this multi-service market has been collaborating for decades to make sure that we could take care of the 250,000 beneficiaries that we have. And so what I have learned being here for the last 2 years is that everyone wants safe patient care, everyone wants a medically ready force, and everyone wants to make sure that we provide great patient outcomes and patient experiences. And so I think that I have learned as a leader how fortunate we are to have this partnership and to be teammates.
I think one of the great parts about this partnership is that we train and educate everyone in a joint environment, regardless of service, and we actually get to know each other in that training platform. And by working together every day as a market, training together every day as a market, when we go downrange, we will be one team, because we're one team here in the San Antonio market, which means we will be one team wherever the military sends us.